Hey guys, welcome back to our channel. Today marks a very special day and something that is very close to my heart. It is the 14th annual World Autism Awareness Day. It is celebrated every year on the 2nd of April with the aims of raising awareness and also increasing the acceptance of individuals with autism spectrum disorder. I used to be a behavioral therapist and I was very lucky enough to be able to work with these awesome individuals. And so I'm very glad that I have this opportunity to share with you some important information about autism spectrum disorder. And in this video, I am going to be focusing on the signs and symptoms and what can you do if you're a parent who notice that your child or maybe you yourself is suspected to having the disorder. So let's check it out. Autism spectrum disorder, also known as ASD, is categorized under the DSM-5 as a neurodevelopmental disorder, which involves persistent challenges in social interaction and social communication, as well as restricted repetitive patterns of behavior, interests, and activities. Unfortunately, the prevalence rate of individuals with ASD in Malaysia is very much outdated, but according to the US Center for Disease Control and Prevention, the CDC, reported that 1 in 54 children in the US have been diagnosed with ASD. And the thing is, they also reported that boys are 4 times more likely to have the disorder when compared to girls. The symptoms are usually noticeable when a child is 2 years old, but the symptoms may be seen earlier than 12 months if the developmental delays are severe, or even later than 24 months if the symptoms are subtle. Now, these symptoms can have a significant impact on the child's and the adult's overall functioning. In this case, the child's academic, work-wise, their social life, and also their day-to-day functioning. So let's take a closer look into the symptoms of ASD. As mentioned briefly just now, there are 2 main symptoms. One is deficits in social communication and social interaction, and the second one is restricted repetitive patterns of behavior, interests, and activities. For deficits in social communication and social interaction, they may have challenges in terms of social emotional reciprocity, meaning that they have difficulties engaging with other people, sharing their thoughts and their feelings with them. So for example, maybe they are not able to have that back and forth conversation, having reduced interest, emotion, or affect, to having failures in terms of initiating or responding to social interactions. Now, another challenge that they face is in non-verbal communicative behaviors that are usually used in social interaction. So for example, the eye contact, gesturing, the body orientation, the tone of voice. So these are things that may be absent, maybe lacking of, or maybe used abnormally in social settings. So I remember there are a few students of mine who doesn't understand the function of pointing. So pointing is what we usually use to communicate to the other person, to direct their attention to maybe a certain item or a certain location. And we had to teach these students, to learn how to point, if let's say they want a certain thing or a certain location, as a way of grabbing another person's attention. And lastly, deficits in developing, maintaining, and understanding relationships, ranging from difficulties in terms of adjusting their behaviors to different social contexts. So for example, in an adult, behaving in a job interview as opposed to be with a group of friends, In children, you notice that some of them may have difficulties sharing that imaginative play or making friends, or some of them may not even have any interest in their peers at all. I remember that I have this student who, he will always get so excited when he sees his friends play, but what he does, he's just laughing and smiling at the side, and not joining the fun of it. For restrictive repetitive patterns of behavior, interests, or activities, they might have two of the following. Firstly, having stereotype or repetitive motor movements, use of object or speech. So for example, hand flapping, rocking their body back and forth. Instead of playing like the toys, they will be lining up in a straight line or spinning the objects. Or another thing that would happen is that they tend to engage in repetitive of speech known as echolalia, and what that basically means is that they tend to parrot whatever that is being heard. So secondly, insistence of everything being the same, inflexible when it comes to routines, or having ritualized verbal or non-verbal behavior. So one of the examples that I can think of is of a student who was very inflexible when it comes to changes in therapists, because whenever there's a change in therapists, he will become very, very frustrated and always wanting the same therapist to teach him. Thirdly, highly restricted fixated interests that are abnormal in the intensity and focus. So for example, I remember there's a 7-year-old who was very much interested in the atlas, the different countries, different flags to a country. He will constantly talk about it non-stop, even with his peers and with me, his therapist. And basically that was the only thing that he wants to talk to me about. Number 4, hyper or hypo reactivity to sensory input, meaning they might be under or oversensitive to either sounds, lights, taste, smell, or even touch. So for example, I have kids who really love toys that has bright lights, and what they will do is that they will shove the toys very near to their face so that they will get that visual stimulation. Or there are some kids who are very adverse to certain types of sound or very noisy environments, and what they will do is they will try to cover their ears and not wanting to hear those sounds or the being in that noisy environment. So Flo, what should I do if I suspect that my child or myself as an adult having ASD? Now, I would strongly recommend for you to set an appointment with a pediatrician. So if let's say it's for a child, or a clinical psychologist or a psychiatrist at a government or a private hospital or center. Now, what will happen is that the child or the adult will undergo a full medical evaluation. So for example, they'll go through a hearing test or other forms of physical examination to rule out any other forms of medical condition. So for example, is it because the child or the adult is not interacting because of their hearing, or what is it, right? Secondly, they will undergo a cognitive or development assessment and assessment for language and adaptive skills. And lastly, a standardized measure of the ASD symptomatology. Right? Through the evaluation and also the assessment, the clinicians are then able to make a clear judgment as to whether the person has the disorder or not. Okay, and from there they were able to recommend the types of treatments that is based on the individual's needs. One thing to note is that there is no cure for ASD, but with the right intervention, for example, ABA, also known as applied behavior analysis, occupational therapy, or speech therapy. It will help to maximize the person's ability to function by reducing the severity of the symptoms and also supporting their development and learning. Now, thank you guys for watching all the way to the end of the video. If you have any question in relation to autism, feel free to comment down below and we will get back to you as soon as possible. Remember to like, share and subscribe, and we will see you again in the next video. Bye!